We assume we know more about health and nutrition now than we did back in the 1800s. Yet people living back then did not die because of what they ate. Before 1900, heart disease, our biggest killer, wasn't even included in medical textbooks. And cancer, diabetes, arthritis, and our other major diseases were rare and confined to the wealthy, who ate like most Americans eat today. People back then did not die of our current diseases because their eating habits were very different. Bread, potatoes, corn, oats, rye, barley meals, beans, and other vegetables, fruits, and whole grains were the major foods in their diets. Meat, dairy products, eggs, and fish were uncommon on the plates of working-class Americans. It's not that they didn't want these foods, they simply could not afford them. But during the 20th century, everything changed. As animal foods became more affordable, Americans switched from their plant-based diets to animal-based diets. This triggered the biggest dietary change in human history and ushered in a new era of eating-related diseases. By the middle of the century, Americans were suddenly dying of heart attacks, and cancer had all the earmarks of an epidemic in the making. In the last half of the century, we doubled our meat consumption, until the average American was eating more meat than they weighed, 225 pounds of meat every year. And while we were gorging ourselves on meat, our consumption of plant foods was reduced to iceberg lettuce, greasy French fries, and ketchup. And over half our calories came from refined foods containing artery-clogging fats. By the year 2000, the American diet had been turned completely upside down. As a result, heart disease rose from an obscure illness to become our #1 killer. Cancer, diabetes, and other little-known diseases became household names. We became the fattest nation on the planet, and we turned eating into the most popular form of unassisted suicide.